Hello, everyone, and welcome in to another Ask Me Anything. I think this is our first one of the year, which is truly exciting. And of course, no better, no better, no better exhibiting partner to walk into 2026 with than our folks at StellaLife that we truly, truly always appreciate. We have with us today Liz Lundry, who is a clinical educator with StellaLife, and Tracy Hubbell, who is also a member of the StellaLife team, who's an RDH. And I believe, Liz, you're an RDH as well, if I'm not
Yeah,
mistaken.
got the
So,
hygiene team here.
yeah, the entire hygiene team from StellaLife is here with us. But we are so thrilled. I want to say hello. So, guys, you will see me look over. StreamYard's kind of weird. We can run on some platforms, but not all. So I'm also over on TikTok as well. So you'll see me look over. So I'm literally running two computers and four screens at one time. So I've got four over here and two over here running at one time. So we're running a lot at once. Welcome in, everybody. I want to make a really quick announcement for those. If you want to comment, ask questions, that's what our platform is today. This is a Ask Me Anything. It's not just me, but you can ask me anything. I am not a clinical educator, so I will probably not be able to give you really good answers. These ladies can do that. However, you can ask me anything you want to. Same way there are folks over on TikTok. Ask anything you like. The folks from StellaLife are here to talk about all the great products that they have, all of their clinical science, which is vast. If you have any questions within their clinical science of their products, they can answer just about practically anything you want to know. And then you can ask me anything. But I would like to say, for those of you who comment today, I am in a very giving mood and a giving spirit for this new year. And Happy New Year to all those I've not seen or had a chance to talk to. We're going to give away some tickets. We have an event tomorrow called our Midwinter Virtual Seminar all day long. You get, I think, 6 CE credits for that event. I'm going to give away 4 tickets to that while we're on here today. So if you comment, ask questions either over on TikTok, and you have to tell me who you are on TikTok because your little username doesn't tell me anything, or you comment here and tell me your name in the any of our streams, either on Facebook, Facebook, LinkedIn, or YouTube. We'll put you in a drawing today for one of the 4 sets of tickets we're going to give away for tomorrow's event. So we are giving some things away today. I may even give away some more. Who knows? Before this is over with. So get in that comment section and start commenting. I already see a comment. So here we go. Hi, Mike. Welcome in. It's good to see you. So if you have questions, ask. I want to stop, though. I would like everyone to introduce themselves. You all don't need an introduction from me. You know who I am. My name is Violet Craig. I'm the executive director of the American Academy for Oral and Systemic Health, heading into my second full year with the Academy. Absolutely love this place. This is my favorite place to be. We have 29 people in here right now, ladies. This is amazing. We're so thrilled to have all these folks. Plus, we have 106 on TikTok right now. So we are rolling away. Liz, will you please introduce yourself to everyone?
Of course, I'm Liz Lundry. I've been a hygienist since 1979, a really long time, and I'm the clinical educator for StellaLife, which I've been with StellaLife like for the beginning of the company, and I'm so excited because I naturally always love natural products and have always used those in my clinical practice. Once I started using StellaLife, it made such a big difference for my patients. So it's like I joined the company and have been so excited to share this with other people. I also do in-office training consulting with the JP Institute, which I've done for over 35 years. So yeah, excited to answer your questions. And I've been a member of AOSH for a few years. Best events, the most learning, the most incredible speakers. I had an opportunity to speak there, so I'm not talking about just myself, but everybody else that you have, like Doctors Bale and Doneen and all these amazing people that can really help us take our patients to another level of health. So I'm just happy to be a member. Thank you, Violet. I'm so happy to be here today.
Yeah, absolutely. Tracy, will you do the same? Please introduce yourself to everybody.
Yes, thank you. My name is Tracy Hubbell, and I'm a hygienist as well. And I am a senior product specialist with StellaLife, and I've been with StellaLife for approximately 6 years. And I had the opportunity to work with StellaLife products with my patients slightly before that, so probably 7 years, 6.5 years ago. And just over the moon excited about the clinical outcomes, the more enhanced patient experiences, and to be able to do some of these things and all these things without any contraindications. It's just something wonderful to be able to offer your patients. And so again, we're here to answer any questions, and thank you so much for providing such an awesome platform for us to connect with people and provide kind of an open communication environment. So thank you so much to Ash and all that you do.
Absolutely. And we have always had a real heart for StellaLife because we know the things, especially the things that you do for patients who are going through cancer treatments. And I want to share a story with you guys really quick that I think is really important from my perspective. StellaLife is an organization that not only gives back to organizations like ours in supporting us in our mission and what we do, but also supports cancer patients as well, because I know that patients who come to you who are struggling with cancer treatments, which guys, cancer treatments, especially for oral cancer, are very tough on patients, very hard on the oral cavity. They provide products for free to patients who are struggling. And that speaks volumes of an organization who's willing to do that and to help patients out so that they can swallow, so that they can eat, so that they can have a normal life and not have to struggle to just do simple things that all of us take for granted every day. Like I just took a drink of water just a second ago. And for a patient who's struggling through chemo and radiation, that is something that is a challenge for them. That is not a norm that they can do. So things like that mean a lot, and it speaks volumes about the organization itself. And I mean, it is touching to me to know just how far the outreach goes. And I know I had oral surgery, had a ton of it all at one time. And Gennady Sororta, who's one of our former presidents of the organization and a member of our board as well, immediately was asking, give me your address, give me your telephone number. And all of a sudden this box shows up at my house that's just massively full of all of these great products that truly did help me make it through having to have a lot of my teeth removed because of precancerous cells and decay from growing up so poor in Appalachia. And I have my own story, but we're not going to get into that. But guys, we would love to have your questions. Like I said, if you have questions in the chat, someone asked me in the chat if I have a cat or a dog. I do have 2 dogs. There's a reason why it is quiet today in my home. They're so used to seeing these little balls of fur that go flying past me. They're daycare today, folks. That's why it's so quiet in my home right now. I know you're used to hearing barking and a baying of a beagle. They are a daycare for a reason, so that these 2 wonderful ladies can actually converse with me without having to listen to the baying of a dog every time a neighbor goes up and down the street. So we are in peace and quiet today. So we are having a great day of peace and quiet. Someone asked about, can you explain a little bit more about your vitamin supplements? So I know that you guys have a great vitamin supplement. That's from Jerry over on our TikTok. Can you guys give us a little bit more information, and either or whoever would like to take that question and field it, to talk a little bit more about your vitamin supplements?
Yeah. Tracy, would you like to?
Sure. Yeah. Liz and I, we knew we were going to jump on here. We were excited to jump on together, but we really didn't talk about hey, how we're going to tag team this off or anything. So we're just going to go with the flow, which is what this is all about, right?
Exactly.
So yeah, we have our Dentamedica. I actually have a bottle of it right here. So Dentamedica is a nutritional support program to boost vitamin D and antioxidant levels. And it can be used 2 ways. You can use that prior to a procedure as a loading dose to help boost those levels prior to surgery or the procedure. And then for a couple weeks post, the 2 weeks post, for enhanced healing and best prognosis. It also can be used at a half dosage for ongoing maintenance per se, or as a daily multivitamin. And we have a lot of periotherapy programs also who will use this as a a product or with their maintenance, with their periotherapies, their 3-month protocols. So if you're using this as a boosting, like a loading dose for your surgical procedures, you would start that 4 weeks prior, 2 weeks post. There's 6 weeks supply in this one bottle. If you were going to be using this as a daily supplement, you would divide that in half, and you have a 12-week supply in this one bottle. What makes this amazing is, I mean, so many things. All of our products, again, whether it's the wound healing or our supplement or our probiotics, are made in the US. Our products are made at GMP facilities, which most of you would know, or if you don't know, is a good manufacturing practice facility. So we abide by all FDA regulations, guidelines to make sure that we are offering the best quality and safest and best product for you. And then they are gluten-free, vegan, and they're non-GMO as well. And the sourcing on these are incredible. So if you'd like to see the full list of the ingredients, easier than you could probably see it right here, obviously, go to StellaLife.com and click on Dentamedic, and there's an ingredients list. But just to give you an example, our vitamin D is sourced from algae, lichen, versus like sheep's wool. So therefore, you're going to have best bioavailability for that. And our vitamin K is from chickpeas rather than soy. And something that I think is super exciting is the folic acid, because so many of us don't have the capability to convert that well or at all. So we use the methylated form. So it's really bioavailable and ready to be able to be absorbed. These, along with so many other things, CoQ10, so many amazing things in here. We're super proud of this product, and people who are taking this as a daily supplement also, we continue to hear the comments of, oh my gosh, it's the first time I've ever been able to take a daily supplement that does not upset my stomach. And again, it's from having really clean source, ingredients in there.
Yeah, I just wanted to add, I've been taking supplements. I got into vitamins in the 70s, and I've been taking lots of vitamins forever. And I was taking a pharmaceutical grade supplement before Dentamedica was released. I was using that for like over 7 years. It was really expensive. It was like $140 a month. And I was taking like these 2 packets, so once a day, 2 packets. And now I just take these 2 Dentamedica. It's so much more affordable. But what I'm finding, as Tracy, you were talking about the GMP, how the FDA oversees it. So what I learned is that when there's not a lot of regulation on supplements in the US, so you really don't know what you're getting. But because we are a GMP facility, everything that we say is in it is actually in it. I've had the experience of buying lysine from like Whole Foods or somewhere, and it wasn't working. And then when I got the lysine, an amino acid, is good if you have like herpes simplex, helps to prevent that. And when I started taking one from a GMP facility, I felt the difference. My body responded. And I'm finding the same thing with Dentamedica, just the way I'm feeling, my energy level. And like I said, I've been taking supplements for a really, really, really long time. And this has been just a phenomenal experience for me. And again, making sure that our patients have the adequate vitamin D so we can reduce implant failures. That's one of the main reasons implants fail, or any bone surgeries, obviously. And then with hygiene and soft tissue procedures as well, we're not eating right, and if we're not doing that and getting enough sunshine, we're going to be deficient. And over 70% of the population is deficient in D. So to help our patients heal, the nutritional aspect is really important.
Yeah, absolutely. So it's interesting because someone asked a question too on TikTok. What regulatory pathways do your products fall under, such as homeopathic, OTC dietary supplement? And how do you ensure compliance with FDA, FTC, and dental board standards?
Yeah, so we are included in the U.S. Homeopathic Pharmacopoeia. So that is a regulatory organization so that, the active ingredients that we use are homeopathic, and all the other ingredients are natural. Everything's derived from plants and minerals with minimal chemical ingredients. So you actually have to shake the bottle when you use it, and it has a shorter shelf life than the chemical mouthwashes that we've been using like all our lives, and the chlorhexidine, we've used them as patients and as clinicians, and that stuff lasts forever, like till you're in your grave. It's still good on the medicine cabinet, but it's not like that with StellaLife, because it's like, very fresh and almost like living. But We are, again, as a GMP facility, the FDA oversees it. So every batch is tested for purity and effectiveness, and everything is very closely monitored. So to actually be able to be a facility producing StellaLife, the standards are very high. And as we're growing, we need more of a supply. And they go through a very rigorous testing before it will work with anybody to make sure that the purity of these products is maintained and consistency is there.
So, and there was a question, and this is interesting because I think most of this is on StellaLife's website. So my folks on TikTok just know we can get you this information, and we can actually, if you go to our website, to AOSH's website, there's links back to StellaLife that I can get you there. So I'll type those in. Just give me a moment. What peer-reviewed studies support StellaLife's claims for reducing postoperative pain, infection, and healing time, and what were the clinical endpoints? So I won't speak to that, but I can tell you we do have ways for you to get that information. But if either one of you'd like to talk about your peer-reviewed studies, I know you guys have tons of studies, so I'll let you guys talk to that.
Sure. So we do have a lot of studies. If you are specifically looking for some topic, you can reach out to any of us, or on our StellaLife.com website. We have an entire education and then research tab where there are multitude of these placed there in their entirety. But we have a lot of studies that will continually show that we are non-toxic to those fibroblasts. So what happens is while we're creating a bacteriostatic environment with the pathogens we don't want present, such as the S mutans, the pyogenes, the P. gingivalis, and such, and many more, we aren't toxic to those fibroblasts. So that collagen production stays nice and steady. We also, I believe you said that question, was asking about pain management as well. A lot of the plants and minerals we work with are analgesic, so they're going to help manage that pain and provide comfort, enhance the patient's experience. And we do also have some information where I believe it was Dr. Lee and Dr. Suzuki had a group of people prior to their surgery. Half of the group used the StellaLife recovery kit 3 days prior. The other group did not use anything going into their surgery day. After their surgery, the group that used the recovery kit the 3 days prior reported less intense pain post-operatively than the group that did not. There is definitely evidence that, using something that's going to reduce inflammation, it's going to decrease the pathogens, and then create comfort prior will, ultimately enhance that patient's outcomes and experiences.
Yeah, that study, Drs. Lee and Suzuki, was published in a journal. Just have this right here. It was the Open Journal of Pharmacology and Pharmacotherapeutics. So it was a case study they did, and exactly as you stated, that's what they did with patients undergoing block bone grafting, which was considered the most painful procedure in dentistry. And again, as they did the study, they found that the patients, they didn't need the opioids. So we can eliminate or hugely reduce opioids when using that recovery kit.
Yeah. So, and that was another question too, was does StellaLife, I'm sorry, y'all, does StellaLife have protocols that they recommend for different procedures, such as implants, grafts, extractions, periodontal surgery, and airway related surgeries?
Yeah, so with the recovery kit, and I don't know if you have one there, Tracy, you can hold it up. You can also see it on our website. But that has 3 items in there. It has a rinse, it has a sublingual spray, and it has a gel. So the rinse is going to disinfect. All the products taste really good, by the way, which is really important. The rinse will disinfect. It also accelerates fibroblast growth. And the sublingual spray and the gel have the same active homeopathic ingredients, but the sublingual spray, which is only available as part of the recovery kit, actually gets these ingredients into the bloodstream. And it provides a reduction of inflammation. It provides reduction of bleeding. So there's going to be less bruising and bleeding with that procedure. It also provides some really excellent analgesia. And it even helps to reduce patients' anxiety. So the sublingual spray does that on a systemic level. And then the gel is applied at the end of the protocol where you rinse, you put the spray under the tongue, and then you apply the gel to the implant site, the surgical site. If you're doing MSC, or if you're doing any kind of, palatal expansion in the orthodontic surgical world, then you would put it on the palatal site there. I've had 2 perio surgeries where my palate was a donor site twice. So you would apply the gel on the areas that are going to have the procedure. And ideally, the patient starts using those 3 products 3 times a day, 3 days before the procedure. And they follow the same protocol the day of the procedure and then 7 days after. So 1 box is a 10-day course. So the rinse replaces chlorhexidine. It doesn't burn, it doesn't stain. We've got this research that indicates that it does rid us of the pathogens. But the other thing with StellaLife products is it helps to preserve a healthy oral microbiome. And we're learning so much about the commensal bacteria. We've been like killing them all because, having grown up in dentistry since the 70s, it's like, we got to kill everything. But now we know it's like, no, we don't want to kill everything because it's going to make us not be able to produce nitric oxide, which keeps our blood vessels dilated. We go over all of this in our live learning. But that's the protocol. And the advantage is if the patient uses it 3 days before the procedure, when they're in the chair, you have a patient that has a disinfected mouth. There's going to be less bleeding during the procedure, which is great for the clinician as well as the patient. They have this analgesia in place and even helps to reduce their anxiety. So, and then they continue using those products while that initial inflammatory response is kind of getting going, where they'll experience the most discomfort. And they got great pain management throughout that 10-day period or a 7-day period after the surgery is done. So, and we go over like how to dispense it, how to use it with your team, as well as insurance benefits, how you can bundle it into the procedure. The recovery kit costs you $63 per unit, basically, and you just make it part of the procedure. And that's the simplest way to present to patients. And we help you with all that when we do the live training with you and your team.
Oh, that's really great. I mean, and I think that's the thing of it is there's a lot of products out there, and I agree with you. Being raised in a generation where it's 100% kills 100%, 99%, 99.9% of everything in the mouth. Yeah, it sure does. It kills everything in the mouth. There's nothing left in the mouth, including the stuff that you actually need in there, the good bacteria. So yeah, that's I have a bottle. My husband and I laughed. We found when I had my first oral surgery, they gave me the chlorhexidine, and you open that up and it smells no different from the first day that they gave it to me 4 years ago before I came on board with the AOSH. It smells no different. It is exactly the same. It looks no different. You pour it out, it's still, into a cup, it's still crystal clear. Nothing in that bottle has changed. And I bet you if I leave it in there for another 8 years, I can come back to it and look at it 8 years from now and it'll probably look exactly the same. It's incredible. I mean, it's absolutely amazing. I don't know that anybody needs to put anything in their mouth that doesn't look any different 8 years from now than it did prior to the 8, with it. But yeah, it's crazy. But you look at it, you see it, it's just doesn't seem right. You would think things need to have an expiration date. I believe things that we use in our body should have some form of expiration date. It does have an expiration date on the bottle, but you would think with an expiration date, you would smell something different or see something different. Or
StellaLife has a 2-year shelf life unopened,
Yeah.
but you should use it in a timely manner. And just to get back to that recovery kit, right now it's available with a peppermint rinse. And the gel is peppermint, but we are now releasing an unflavored gel. And we're going to be releasing another non-mint flavor. So we will have a mint-free recovery kit soon.
Nice.
Right now, if anybody is sensitive to mint, as some people are, we have the coconut rinse, which is more hydrating, more healing. They're all healing, but this one is, in a kind of class on its own. And that can be subbed out for people that are sensitive. But the mint-free gel is out, which I'm excited about because we have young people using it that are sensitive to mint, burning mouth patients, those oncology patients you were talking about as well. And there's a great experience from one of our AOSH members, Dr. Mike Milligan, who actually went through radiation of the head or neck. And he credited StellaLife with his being able to continue to swallow, as you were talking about earlier, Violet, because if you stop doing it, your body forgets how to do it. And it's really hard to get that reflux to come back. But for those people, going through any type of chemo or radiation treatment, the mouth becomes so sensitive. So we've had that coconut rinse out for over a couple of years now, but I'm so excited about the mint-free gel coming out, to really help out those patients and anybody else who's got any issues with pain and have the sensitive mouth as well.
Absolutely. Yeah. Also too, I think in regards to that question, they were asking about procedures and applications, correct? So the recovery, obviously those are going to be for your surgical patients, your patients who are experiencing more pain, because in a sense that spray is considered like your extra layer of pain management, being able to create that therapeutic level. We also, our products though, we're great for so many other different conditions and procedures as well. So we provide our teams with, easy to follow list of, how they would use the products with scaling and replaning, how they would use that for conditions such as dry mouth. We're a great solution for that with our coconut rinse and our gel, and soon non-flavored gel. And then with like dry socket, great option for that. And then any type of a removable appliance from the mouth, if there's any type of sore associated, tissues that's bothered, that gel, it's antimicrobial, it's anti-inflammatory, and it provides analgesia. So it's 3-pronged. You can place a ribbon of that into the trough of any of those, place that, whether it's an immediate, anything like that, place that in there. And it's very, very helpful for that patient through the process. And then aphthous ulcers, another one. People love to have a tube of that gel handy for aphthous ulcers. So there's a lot of different applications, from conditions to non-surgical therapies to our surgical therapies. And I did also want to note, and this, Liz is so educated in all of this too, but with our products, we are very transparent with everything that's in our products. So this recovery kit box that we had alluded to has all 3 products in it. So the ingredient listing for all 3 are on there. And one of the things that I loved as a clinician working with this was that, wow, it not only tells me that it's arnica, but then it tells me to the right what it's for. It's for bruising and swelling. So it's kind of helping me learn about this as well. And I know when I first started recommending this in my little small southwest corner of Michigan 6.5 years ago, I just, I had a preconceived notion maybe that my patients might think it was snake oil or hippie juice or something, right? Just because it was a natural product. But I was corrected very quickly because I noticed patients pick it up and right away they noticed so many of the ingredients in here. And I realized like, wow, that's information they really sought out on their own. You don't necessarily go to your medical doctor and then tell you about some calendula and arnica. So it was really exciting to know that. And I use the comparison a lot. I use like something like Norwex products. How long have we cared about what we're wiping our windows and our kitchen countertops with? Like what, 15 years or more? And making sure we're not using chemicals or toxins for those. So it's even more important that we're really looking at those things for our bodies as well. And I think people are truly more than ever, seeking those things out and looking for those options.
Yeah. And then also like with use of the rinse, we have all these different applications. So like with xerostomia, but we also do eliminate strep mutans with that rinse. So anybody who's got a high caries risk, or people with drier mouths tend to have a higher caries risk. But if you're doing camber, you can use the StellaLife rinse instead of the chlorhexidine. And then whatever remineralization, or if you use fluorides, or whatever products you recommend with that. But it is designed to be used as a daily rinse. I and my whole family use it every day. So you can use it safely, again, because it helps to support a healthy oral microbiome. It eliminates the pathogens. And what gets me really excited as an educator, and now we're working very closely with Apollo Health, which is an organization created by Dr. Dale Bredesen. And if you've read or seen The End of Alzheimer's, you know who he is. If not, you need to read the book. Everybody should read the book. And he actually has the protocol that has been proven and just released a new study that was recently completed. You can reverse dementia and you can prevent dementia. So with that, StellaLife rinse has become part of the protocol because it targets PG and FN, 2 of the primary pathogens that trigger dementia. There are 36 causes of dementia. So you need to cover the whole spectrum, and that's what the protocol is all about. But our offices get our patients to have that as part of their daily protocol of reporting when they come back for their perio maintenance or for their dental procedures. They don't have the bleeding and the inflammation that they used to, because we're targeting those pathogens which are also related to these other diseases. So we can hopefully have a healthier body using this, as well as a healthier mouth. So we're literally saving people's lives. That's part of our mission at StellaLife. And that's what you do in dentistry every day, right? We're saving lives, treating perio. So this is a great addition to our daily protocols.
Yeah, and that's why we love StellaLife. You know, AOSH is on this road of oral systemic revolution. And being a part of that revolution is bringing on partners who believe in the same life-saving, life-sustaining, lifelong journey with patients. And that's what we know that you provide in the products and services that you share with our dentists and our practitioners. I did have a couple of comments over here that I want to share. Rachel said, my mom had a bone graft and used the recovery kit you're talking about and said she didn't have any pain and really liked the taste. So there you go. There's a great, Rachel, if you will, I'll put my email address up. I know that StellaLife loves good testimonials. You could send me an email and I would love to be able to share some contact information so that they can get some good testimonials, because there's nothing better than hearing from patients and from those who have benefited from the products. Also, too, I had a question from Karen. Can we recommend StellaLife in place of CHX?
Absolutely. A couple reasons. First of all, clinically, I know clinicians get excited because our product doesn't have any stain. It doesn't leave an altered taste. But there's two other key points with that. One is obviously those fibroblasts that we mentioned. When we are non-toxic to the fibroblasts, but yet keep the other pathogens at bay, like the S mutans, the P. gingivalis and such, they proliferate in that environment. So when clinicians ask us, like, okay, what's your active ingredient that's speeding up healing? We don't have an ingredient that's speeding up healing. What we're doing is we're not, our product's not so strong that it's, again, like we had mentioned earlier, depleting all of the things that we need by being 159.99% bacteria kill. So we're allowing the good pathogens to flourish. And so that works best with healing. And the other thing that we're learning about too is we all know that chlorhexidine has the ability to raise blood pressure 2 to 3 points as well. And again, that is because it is a very strong product. What it depletes is the nitric oxide, and nitric oxide regulates our blood flow and our blood pressure. Our rinse does not affect nitric oxide levels, which is super important. And definitely one of the things when I go into practices anymore, we want to have discussions about the chlorhexidine and about our rinse being an alternative. But what I ask them now is, instead of some of those kind of standard questions, is I'll ask them, what kind of mouthwash are you recommending for your patients post-healing or for everyday use that have high blood pressure? And we've been having some great conversations that way. So, that's another reason why it's a great alternative for chlorhexidine. It's just definitely, we've all used chlorhexidine. It was the gold standard, but we're just learning so much more about the body health connection, not just our gut and our mouth, our heart to our mouth, but also our brain health, as Liz had spoke about as well, which is so, so important.
Yeah, I used to irrigate with chlorhexidine with maintenance and scaling and plating for years. Then we got StellaLife in the office, so we started using that. So yeah, it's not only non-toxic toward the fibroblast, but we have university studies proving it accelerates fibroblast growth. And Rachel, I'm so happy to hear that your mom had a good experience, after her bone grafting. This kind of feedback we get. But the healing is so fast because of that accelerated fibroblast growth. I was hearing an experience from a doctor who had placed an implant, and the patient came back for the follow-up, and there were sutures there. And he said, wow, this healed really quickly. Let's take the sutures out. And the assistant said, no, it's too soon. It's too soon. And he said, but look, it's healed. So people are less likely to lose sutures and membranes because of that accelerated fibroblast growth. And as Tracy was saying, we support that nitric oxide production because we help to help actually support and promote the growth of the commensals, the friendly bacteria that produce that nitric oxide gas. So we really try to support that healing in many ways, as well as giving the pain management.
Yeah. Karen was wanting to ask too, can I request those guides and possible sample products to display in our office? Karen, if you will drop me an email, I will get you in touch with the folks at StellaLife so that they can get you those types, or at least have those conversations with you so that we can see, so they can see what they can do to help you out with that. I've got tons of questions. I've got more questions in the past 10 minutes, and I don't know if we can go through all of them at one time. Are there any known contraindications for immune compromised patients, cardiac patients, autoimmune patients, or those on biologics or anticoagulants? That is a broad question. Wow. So that's a lot at one time. But yeah, just the contraindications for those with their immune compromised, cardiac, autoimmune, or those on biologics or anticoagulants.
So we can talk about that together. There are no contraindications with any medications. So the only contraindications generally are if somebody has allergies to any of the ingredients, which are all listed on the packaging. Because we're regulated by the FDA and they put things in categories like disinfectants, like chlorhexidine, we state that if the patient is younger than 6 years of age, or if they're pregnant or lactating, the products are used under the care of a healthcare provider, which would be the dentist. If there are any questions, you can ask the OBGYN or the pediatrician. But if somebody has a specific, more unusual condition, because as far as autoimmune, a lot of our patients are autoimmune patients because they have, like, I had a geographic tongue patient who has an autoimmune condition, got her on the coconut rinse. She used it 3 times a day. And after 2 weeks of using that, the lesions and sensitivity were gone. And it's a chronic condition, so she needs to use it ongoing, using it twice a day for maintenance. 2 years later, she's had no recurrence of the lesions or the sensitivity. You can see her tongue on our website, StellaLife.com. Go to the research page and scroll down and click on geographic tongue, so you can see her before and after images there. So a lot of those patients that you're talking actually really need the products because of the issues that they have in their mouth with these other medications and with their conditions. But sometimes, we will just say for the patient to check with their physician specifically, if it's anything that's more unusual. But with most, we haven't really had any issues with general medications, which is why it's not contraindicated against any other medication. So I don't know if you have anything to add to that, Tracy, or have come across any questions that have come up like that.
No, not at all. That you pretty much covered it, Liz. Of course, if they're seeing a specialist, just as we find it just as imperative that we know about their medical history, it's important that their specialists know about their dental history and the things that they're using as well.
Exactly. The whole connection between dental and medical, right? Yes.
Absolutely.
Yeah. We always tell anyone with any, so we'll get questions in about all of our exhibiting partners. At one point or another, we have had a question about something, and it's like, one, we are not the expert on any of these products. Our product placement folks, the folks who actually own the product are the best people to ask. And we always get asked, well, is it safe? Well, go talk to the folks, who have the product, and then they will tell you who you need to talk to. Most of the time, it's always talk to your doctor, talk to your dentist. They're the folks who can help you figure that out the most, because your specialist in whatever area can typically tell you if you might have some issues with it. But the great thing, with StellaLife being homeopathic, unless you really do have a severe allergy to something, that's a great thing about the products. It's not going to, a lot of folks have codeine allergies, and there's some other things where you're not dealing with that. In this case, you're dealing with a totally homeopathic product, but always check with your provider. I'd say that about anything. Before you start anything and you're worried about it, and you've got a funky immune system, it may not take something, you might want to ask anyways about just about anything you start. So it's always a good idea. Someone, Kelly, asked, what is the purpose of the spray?
Oh, that's a great question, Kelly. So the spray is that additional layer of pain management. It's how I try to explain it. And that's why it's only in that recovery kit. Oftentimes for some conditions, the rinse and the gel may work perfectly because it does have some pain management, with the inflammation control, antimicrobial properties of the gel, and the analgesia. However, there are procedures like surgical, or sometimes your more severe perio, where that patient is going to either maybe want something additional for pain. And that's when you go to that recovery kit because of the spray. The spray, as Liz had mentioned, is your sublingual. It's going to get into the tissues quickly. And then the gel is your topical, placed on top of the tissue, irritation, surgical site, ulceration, what have you. So you're really kind of meeting that pain with the analgesia in the middle to create an all-over therapeutic level of comfort. So it's for the increased pain management. And as a hygienist, and Liz, I'm sure feels the same, you hear about new products and you'd want to incorporate them. And I'm thinking in my head, I have 50 minutes to do this in an hour and 10 minutes worth of work. How do I do this and know what to do? And so really, I just started breaking it down. It was the pain management factor of it. Will the patient heal well with the rinse and the gel and be comfortable? Will they have a good experience? If I knew right away due to bleeding, inflammation, or their questions or their history with me, then I'd recommend that recovery kit. And for all surgical, always recommend the recovery kit because there is more discomfort associated with those procedures.
Yeah, and then with scaling and root planing, if they're diabetics, heavy bleeders, or sensitive patients, the recovery kit is the way to go. And because we've got the sublingual spray and the gel, same active ingredients, but again, the sublingual spray gets it systemic, reducing inflammation, reducing bleeding, and providing analgesia. So, and then we put the gel on top, literally topically. So we're treating the patient from the inside out with the spray, and then from outside in with a topical. And everything works together synergistically to give the clinician the benefits of less bleeding, less pain for the patient, and less bruising and swelling as with the bleeding reduced. So yeah, helping it from all angles.
Awesome. So so my folks over on TikTok are far more intelligent than me because they know things that obviously I don't. We have a lot of RDHs, young RDHs, and a lot of students who join us over on TikTok. So for our student folks are asking if there's shows that you're going to be attending in the near future, events that they may be at. I know you guys mentioned that you're going to be I think you're going to be at Chicago Midwinter. I know I want to make a comment. We are going to be at Hinman, and I think you guys are going to be there too. I have a lot of students who are going to be at Hinman. Guys, this is a great opportunity for my students that are out there to come by and visit with us at Hinman. So come by and see me. I think we're going to be side by side. If Gennadi's got anything to do with it, we will be. So we're going to be side by side in Hinman. That's a great opportunity for you guys to come by and visit with us at Hinman in Atlanta. So that's one of the shows. Is there any other shows, guys, that you're going to be attending or events that you can kind of let us know so folks can come by and see you in the near future?
There are things we have scheduled throughout the year, like we're going to be in New Orleans at the AOSH
yes, absolutely.
But
yes.
The best thing to do is to contact us directly. You can do that through the StellaLife 800 number and ask, like, where would I'm in Missouri. Do you have any events coming up in my area in 2026? So we can do that, or reach out to us individually. Violet can refer you to us, but that's the best way because it's a dynamic situation. A lot of things being scheduled and already on the calendar for 2026. And I can't think, okay, I'll go through the list of them.
Exactly. So guys, if you're looking for an opportunity, if you're a student, because trust me, we love you. We know you're the future. We know you're the future of dentistry and of medicine. And if you want to come learn, we want you to come learn. So please don't worry. You'll find opportunities. I promise you, because they're kind of like us. They go everywhere and travel a lot. So you'll see StellaLife out there. They make themselves well known out in the dental community. You will have that opportunity, I promise. But we will be, someone asked specifically about Hinman. Yes, we will be at Hinman. All of us, we're going to be there. So we'll see you there, and we'll be very close, if not right beside StellaLife and a few other of our exhibiting partners as well. I had a question. So this is interesting. Have you evaluated StellaLife's impact on red complex pathogens?
Yes, we have. And those are some of the studies that we actually share with you. And we also work very closely. And if you're doing, with that question, if you're doing saliva testing, because with saliva testing, you know exactly what pathogens you're dealing with. And with, like, for Simply Perio, for example, the oral DNA labs, we work with them and they do recommend StellaLife depending on what those results are, whether you have the PG, the FN, the Tenorella, whatever else you have present. So you can be very specific in your testing. But yes, we have had studies that show the effectiveness, a number of them actually. And this is where also, the training, which we do have a recorded training on our website that you can take a look at. But it's also really great to do it live so you can ask more specific questions and we can share those actual studies with you.
Absolutely. So I have a brand new RDH. Her name is Deborah. She's over on TikTok. She says, I have been in RDH now for 6 months. How does StellaLife support connective tissue healing after scaling and root planing or periodontal surgery?
So I'm sorry, supporting that as far as the healing process of that, obviously our rinse is very supportive in that, being all the things we mentioned, non-staining, compliance, non-toxic to those fibroblasts for your best and most, best prognosis and healing, and your nitric oxide. However, with that, the protocols for that, you would want to make sure that you're following your protocols. It's going to enhance that with your periotherapies. As far as the tissues go, we also have some suggestion and actually a great study with our probiotics as far as tissue health with a periodontal patient. So not only are our products through like our oral wound healing products recommended for periotherapies and periodontal maintenance patients for healing, it's also our probiotics are recommended for those patients as well. And there was a case study in the Dental Advisor this past summer by a periodontist, and they followed a patient who just had tissues. They just were not responding to traditional things that would typically help the tissues improve, the gingivitis, the red, inflamed, bothered tissues. The patient needed periotherapy, and they were going to be going into orthodontics afterwards. So they put the patient strictly on our oral and gut probiotic kit. And the patient, within 4 weeks, the tissues looked so much better. They followed the patients for 4 months. The patient had their periotherapies. The patient is in orthodontics now. And they recorded the tissue depths, the pocket depths, bleeding points, and plaque scores during this time, and all had significant improvements. And those are all documented, and you can view those on our website as well. But it was a really, really nice case presentation in the Dental Advisor from a periodontist with a periodontal patient.
Yeah, so with the bacteria, if we can regulate that oral microbiome and have a good population of those commensals, the pathogenic bacteria don't have a place to latch on. So there's just no parking spot for them. So we're able to keep people in remission a lot longer and accelerate the healing. And then the rinse itself, like using it for irrigation, in hygiene, or having patients use it at home, but definitely with SRPs, you're talking about this on the cellular level, we are accelerating fibroblast growth. You're going to have more rapid collagen formation. The products reduce inflammation. So that's also going to help with, the patient's, the way they feel, but also the healing overall is going to be much quicker. And we do have the studies that prove that that does happen on a cellular level that we can share with you. But this study from the Dental Advisor was so encouraging, and they didn't use any other StellaLife products for that study. No oral care products, no rinses, nothing, just the probiotics kit, which has a gut capsule for your gut microbiome and then a lozenge to dissolve in the mouth to get that oral microbiome happening. And the lozenges are available as a standalone product as well. We're seeing a trend with that in dentistry. So we're the only company that has the species that we have. Nobody else has those species. And nobody else has a kit that has both in one. So you can take care of both ends, right? Because it's all connected. So the response has been great. The improvement and the stability with that particular case was really exciting to see that.
Yeah, that's there's some comments that are coming through that are interesting too. It says, wondering if StellaLife has been listed for pain control in sleep apnea and airway patients where opioids are especially dangerous.
Right. So we're trying to, the opioid epidemic, another epidemic like the epidemic of periodontal disease and overall poor health, right? But with the use of the recovery kit, we're seeing that really don't need opioids at all. That is crucial. I was able to sit in as I was exhibiting at a study club in California, where I live. The doctors have to take an opioid course for their licensure. I'm sure it's happening all over the US. But I attended one of these courses and learned that 1 in 10 people become addicted to opioids after one exposure. That's pretty frightening. And we've been dispensing these things without a thought with every procedure. I learned that I live in a pretty nice area, good neighborhood, and we have really good schools. And I learned in our local high school, the kids are selling the opioids. They get them when they get their third molars removed, or if they're an athlete and, have knee surgery or whatever, and they don't need them. And then they're selling them. It's a cottage industry that we've been kind of supporting, but we don't need to use that when we use StellaLife. So that goes a long way toward reducing that. So, and I think there was another thing that you mentioned that I wanted to comment on in that question. There was the opioids, and then there was some other element in it that you had mentioned. I don't know if you can read.
Yeah, it said for sleep apnea and airway patients. Yeah, where it's especially dangerous.
Yeah. So exactly. So we don't want to use those types of medications if we don't need to, and we don't need to so much with StellaLife, or we could hugely reduce the amount of the pills that they get. But with airway in general, as I mentioned, if we're doing MARPs or you're doing MSE and you're actually expanding the palate, then you can use that recovery kit. It'll accelerate the healing, because I went to an airway conference recently, and one of the doctors who placed her own MARPy said she wanted to rip it out of her palate. It was so painful. But with the StellaLife, you're not going to have to go through that. So they're comfortable. And just generally with airway patients, hopefully they get all the orthodontics, the myofunctional therapy done so they can function. But if they have to use a CPAP or, do whatever else they're doing, they tend to get very dry mouth. So like using that coconut rinse before bedtime, and then even putting a bit of the gel on the tongue, doesn't stick to the roof of the mouth. We can help those people be more comfortable, so they can breathe.
Yeah. So there was also there was a comment that said, it's from an user. I understand why you have your name blocked. It's okay. Don't worry about it. Because the comment was, I wish that I could convince the oral surgeon that I work for to stop giving away just in case opioid prescriptions after oral surgery. It's okay. I understand why you can't share your name. Don't worry about that. But yeah, I think it goes to the part of that epidemic that there are a lot of those just in case. And then, like you said, Liz, they're showing up in schools and other places where kids are selling them. And then we end up, and the sad thing is, in many instances, kids don't understand that they think they're getting an opioid pill, and truly it's not just an opioid. It looks good, but it's laced with fentanyl. And then we have someone who's no longer with us because they got a hold of something that was poison and deadly. So
we have team members who've lost family members and friends to opioid overdoses. So this is something that's, really part of our mission to do something about this. And you're all empowered to do that by using a natural product that provides really great analgesia. So yeah, it's critical that we really look at that.
yeah, absolutely. So a couple of other questions. We've already answered something similar to that, guys. Yes, this is being recorded. Yes, you will have access to it because we did this in a studio so that I could make sure that it was recorded. So you should have access to it. We've already answered that question. So we're coming back around to some questions that are being asked again, which is great because that means we've answered a lot of questions, which is even better. Do you have case studies showing reduced post-op pain scores compared to hydrocodone or oxycodone?
So the studies that we had mentioned, and we do have a lot of studies happening right now at different universities. And I know for a fact that in one of them, they are looking at patients who are going through surgical procedures using their typical protocol and then using the recovery kit. So we're waiting for more of those studies to come out. And so we're, again, always doing more research, and it takes time for these studies, but we have so many. I remember when I started, we didn't have any. Then we got the bird study about the fibroblast, chlorhexidine sort of comparison with StellaLife. And we do have these pain management studies that are ongoing, and some that have been published and are in our live learning that we do.
Absolutely. So that's an interesting question. How come all three of you look like you have skin that's made of silk, and I can't get mine to look that way? Well, I will answer for myself on this. I have really good makeup, so that's my answer to that. I think all women try to take very good care of their skin. I know if you ever get to meet Liz in person and Tracy both, they're absolutely beautiful women. So they've been blessed with very good skin as well.
Well, you too,
Mine is
Violet.
mine is covered up. I'm very good at covering up the age marks and things. I'm 48 years old and grew up, in a time where, and I think everyone in my age group, Gen X, can talk about this. We were out in the sun all day long in the summer because mom and dad kicked us out of the house and said, go find something to do with your time that doesn't involve being under my nose all day long when we were off on summer break as a kid. So I spent a lot of time outside, unfortunately, without a lot of sunscreen. However, I was a hat wearing kid. I liked wearing a baseball cap all the time. So I think that's the only thing that kept my skin from being completely ruined. I was a garden hose drinker, all those things that are probably terrible for me now looking back on it. But thank you. I know all three of us say thank you for the comment. That was very sweet of you. I appreciate that. I know we all do. Yeah, we get asked a lot of things. I get some, things will come across. You just never know. Does AOSH support? No. So with exhibiting partners, let me kind of explain to you how that works. And for those of you that may be interested in being an exhibiting partner, how this works is exhibiting partners support AOSH all year long through providing us with the ability to share their products and sciences, and then they support us in turn with being able to be an exhibitor with us. So while yes, it is financial, it's not like they're just buying to walk in the door. We vet every single person that comes through the door, every organization, well, not every person, but every business that comes through the door. You can't just walk in here and say, here's some money we want in. There's a vetting process that you go through the science and education committee with us, then with the programming committee, and then through the board of directors, and then a vote is taken. So no, you can't just walk in the door and say, here's some cash, lay it down, and walk in. Every single exhibiting partner that we have has gone through a vetting process. No, you can't just walk in here. If you'll notice, every exhibiting partner we have on our sponsor page is a product that has a lot of science behind it. You can't just come in here and say, hey, here we are. It's just not how this works. Michael asked, what is the pH of your products? And I know you guys have a lot of products, so I know there's different pHs with a lot of different products. So
just generally speaking, there's a bit of a range because like with the rinses, it's derived from plants. So things can vary slightly from one crop to the next. And again, we're very selective about the source of all of these things. But generally speaking, it's roughly the same as a cup of black coffee. So slightly acidic, but as we are developing these other rinses, they're getting more and more close to neutral, but nothing crazy. We've never heard and had any documented issues with erosion, chemical erosion of any kind. And because we do handling the strep mutans as far as caries control, it's a great product. But that's kind of as we're eating, hopefully we're eating fruits and vegetables every day. And a lot of the fruits that we eat are way more acidic, but it doesn't stay in your mouth all the time. Your saliva should neutralize it out, so whatever we consume, and with StellaLife, we're rinsing with it. We're not using it and keeping it in the mouth all the time. So it's never been an issue, but that's roughly what the pH is. There's a little bit of a range there.
All righty. So Michael said, I know you have many products. Thank you. Appreciate that, Michael. So I think, guys, I have most of the questions I have are repeats at this point. So what I will do, Michael, I don't know if you will give me, share an email address of me back to violet@aosh.org. I have several people that I can give away some tickets tomorrow. If you would like to come to our Midwinter Virtual, we would certainly love to have you. Ladies, if you would like to wrap this up and give some final thoughts, that would be great. I would be honored for you to do that. So if you'd like to, both of you like to go and do a little wrap up here, we would be glad to do that.
Take it away, Liz.
Okay. I'm delighted that we were here today and we're able to give you some answers, and we're here for you. So whatever specific concerns or questions you have about different conditions, about different applications, our job is to educate everybody. And we do send complimentary products when we schedule live learnings and provide ongoing support as people are customers. And Tracy, I've had customers we've worked with for many, many, many years. And we develop great relationships with everybody. So again, our mission is to improve lives and to save lives. And again, we want to help you do that, because I know treating periodontal disease, we're doing that every day. And our mission is to elevate the clinical care that we give. And as we learn more things and the research grows, StellaLife will continue to innovate. So we have new things coming out this year and a lot of things, in the hopper that we're excited about. So we'll share that with you as that's available.
Yeah, definitely. This is going to be a super exciting year. A lot of new things, new information coming out. And as you all know, information with anything comes out much more quickly every year than ever. So it's super exciting. And Liz also mentioned that we're here to help you. And I think that's one of the biggest things that I hear myself, my teammates, our company, always telling people is we're here to help. And your feedback is so utmost important to us, because we learn from you all every day, and we can't grow and do more, get better without all that feedback from you all. So thank you so much. Any questions, no matter what they are, and we're here to support you, your teams, provide ongoing education. And thank you so much for all your questions. And thank you again, Violet, for inviting us. And thanks, Liz.
Thank you all. Yes, we have, you can leave reviews through Trustpilot, which is a completely independent review source. And we've got like 5 stars on Trustpilot. We have very high ratings on that. So if you have any concerns or comments or questions about, please leave reviews and then let us know if we can help in any way. So thank you again. Thanks.
Absolutely. And we are so grateful for our great friends at StellaLife. We are so grateful to you guys. We thank you so much. Everybody that dropped in, we are so grateful for you guys as well. We always love to see everyone who comes through. So we have everyone from students all the way through retired professionals that stop by and say hello to us. So we are so grateful for you. If there's anything that we can do for any of you, I know these ladies will be glad to answer any questions you have. You are welcome to email me at violet@aosh.org. I love doing these. They're so much fun. The questions and answers are always great, because you never know what you're going to be asked. And they're always great. They're always full of information. We never walk away from these without learning a lot. Guys, we're so grateful for all of you that stopped by today. We love you. We appreciate you. If there's anything we can do for you, please drop me an email. We would love to do that. I'll reach out to some of you. If you would like to attend tomorrow, we've got some tickets to give away to tomorrow's event. Just drop me an email at violet@aosh.org, and we will give away some tickets to our Midwinter Virtual tomorrow, which is sponsored by StellaLife. They're one of our many sponsors that we love and we're grateful for. So we're grateful to have each and every one of you who stopped by today. Please come by and see us again. We will have these throughout the year. They're lots of fun. So come by and see us. Thank you, ladies. We'll see you soon. Have a great day. We're going to go ahead and end this, and we'll see everybody again really, really soon.
Thanks,
Bye.
Tomorrow, actually. Bye-bye, guys.
Okay.